All right. Thank you everybody for attending and for being with us here this morning. For anyone that doesn't know me, or if we have not yet met, my name is Stephanie Morris, and I am the director of the Refugee Alliance of Central Iowa. And every year we host a refugee summit where we can offer content just kind of across the different sectors. So whether it be education, employment, housing, health, mental health, just a variety of information and resources that can help service providers or teachers, health providers, anybody that works with refugee communities or refugee families, just learn how to do that work better and to be more aware of resources that exist for them. So today we are going to be focusing on what's been a lot that's been a lot in the news lately is what's going on with Afghanistan and people that have been evacuating from that country who have had previous ties with the United States military or other circumstances that have caused them to flee and then come to the United States as part of an SIV program or other circumstances. So today we're going to hear from experts. We're going to hear from the director of resettlement from Catholic Charities, Kellen Anker. We're going to hear from the director of resettlement of the USCRI Des Moines office, Carrie Trufunk. We have Sarah Zenick from Catherine McCauley Center, who's the director of refugee and immigrant programs there. And then the state of Iowa bureau chief from the Bureau of Refugee Services, Mark Sucheska. So I will turn it over to them to then kick us off, but then also just wanted to make sure attendees were aware that after they're done presenting, if you have questions, we'll have time to do a Q&A at that point. And you can always type into the Q&A box or the chat box if you have questions, and we can address those as we go, and then after the presentation as well.
All right, so we're going to start off with the history of resettlement, correct? All right, well, good morning, everybody. Again, my name is Mark Sucheska. Serve as the bureau chief for the Iowa Bureau of Refugee Services, as well as the state refugee coordinator for Iowa through the Office of Refugee Resettlement. And I'll be using acronyms as we speak, ORR mostly, and PRM. Those are the two primary organizations that really focus on resettlement across the country. So as a state, Iowa has been receiving refugees and part of the resettlement world since 1975 officially, when Iowa first resettled Southeast Asian refugees to the state. Subsequently after, Iowa has really been a leader in refugee resettlement, one of the top destinations, I would say, for refugees coming to the United States. From the 70s, 80s, and 90s to where we are today, we have seen a very diverse demographic and population of folks arriving to our state. Not only to Des Moines, where the largest amount of people do arrive, and where the two largest resettlement agencies are established with USCRI and Catholic Charities, but also across the state. Many refugees have enriched communities over the years, have revitalized communities over the years, and continue to survive and I guess thrive, for lack of a better term, as they make Iowa their new home. With respect to resettlement and where we are today, our world has really turned upside down, for lack of a better phrase. These last 4 years and continuing forward with the next 4 years will look drastically different for resettlement. Highlighting the Afghan crisis is just a piece of really the ever-changing resettlement landscape as we will continue to see it going forward. With the Afghan crisis, our entire network with our partners on the call today, and many of you who are listening, have really been mobilized to strategize and collaborate really at an expedited level to rebuild an infrastructure that was lost, and continuing to have those conversations and collaborative meetings to really figure out how we can support an influx of refugees that are set to arrive. I would say probably here in the next several weeks. We, as a state, we've been working diligently through the Department of Human Services, through the governor's office, through our resettlement partners, faith-based organizations, and really the business sector as well, to figure out what gaps exist in our scope of services when it comes to resettlement, how we can navigate some of these nuances between the designations of categories of folks that will arrive. And Kellen, Sarah, and Carrie will touch on that a little bit, particularly between the SIVs and humanitarian parolees. Those are sort of the two terms that are kind of the hot topics right now. What services will be administered, who will receive what, and sort of what the duration of these services will be. But as we continue forward with resettlement and accepting people to our state, it's very important that we continue the legacy that started in the 70s, to continue the welcoming environment that Iowa has established over the years. And if there are gaps and barriers that we may face as a network and as a community, it will be imperative for us to work together moving forward. As noted, and I really can't say this enough, the landscape of refugee resettlement looks different. The folks that will be arriving will have unique challenges and barriers. It is imperative upon us to educate ourselves, to work together, and to find ways to continue the work that has been going on for the future. And so I look forward to working with all of you, with our resettlement partners here on the call. The Iowa Bureau of Refugee Services will continue our efforts and leading the call and advocacy and supporting refugees and immigrants as we look to expand our office, as we look to expand our supports for our nonprofit and resettlement partners going forward. So I will turn it over now to our resettlement partners to share a little bit more about how resettlement works and what the journey looks like for refugees coming to Iowa.
Thanks, Mock. Hi, everyone. My name is Kellen Anker. I'm the Refugee Services Program Manager with Catholic Charities. And I'm going to kind of give a brief overview of kind of what the process is overseas for a refugee before they come to the United States. So a refugee is someone, for those of you that don't know, that has fled their home country and can't return because of a well-founded fear of persecution based on either religion, race, nationality, political opinion, or membership in a particular social group. It could be a combination of all of those things. They usually flee into a neighboring country, which we consider their second country, and they are housed in refugee camps that are usually set up by the United Nations High Commissioner for Refugees, or UNHCR, which there they can register as a refugee, and UNHCR helps determine whether they're qualified and should be resettled into a third country. At the end of 2020, there are approximately 26.4 million refugees around the world, and that does not include almost 40 more million people who are just considered displaced for various reasons. Of that 26.4 million number, only about 1% are resettled into a third country, meaning they would be assigned to United States, Europe, Australia, a variety of other resettlement countries. The average wait time for most refugees in those refugee camps can range anywhere from 18 months to 3 years or even longer, depending on a variety of situations. But once they are registered with UNHCR, they are referred to what is called their resettlement support center in their country, and that is where they begin the process of coming to the United States. And I will pass it on to Carrie to kind of talk about that process from that point.
Thanks, Kellen. Like Stephanie said, I am Carrie Funk, and I am the Field Office Director for the U.S. Committee for Refugees and Immigrants Des Moines office. One of the things that is misunderstood about refugees is that they are the most highly vetted group of immigrants coming to the United States. When folks go into the camps, register with UNHCR, and are assigned to an RSD. If they're coming to the United States, the Department of State has a very long and arduous background check process. It includes a number of security screenings, including pre-screenings. There are in-depth biographical background checks and interviews. There are a number of what are called interagency screening checks that further delve into the backgrounds and both the individual refugee and of the family of theirs. They go through fingerprints and just to ensure that they're not anywhere in a criminal database or have had previous immigration into another country. They have a biometrics background check, which is then completed for all non-US citizens. And then they have a DoD forensic and biometric background check system. So as you can see, it's a very repetitive system that includes a large number of interviews, a number of medical screenings, because refugees that have certain medical issues are not eligible for resettlement in the United States. And so when we talk about immigration and background checks, and some of the conversations that have happened in the last 4 years about fears of who is being resettled, folks are going through some of the most in-depth background checks that any civilian is undergoing before coming to the United States. When it comes to Afghan arrivals and the security screenings, we'll talk a little bit about the different kinds of entrance routes for Afghan individuals. However, before anybody is coming to the United States, they are, after being evacuated from Afghanistan, they're undergoing initial biometric screenings in third country, what are being referred to as lily pads. And because that system takes a little while, there's still 18,000 people waiting in those third country lily pads to even come to the United States, to the military bases for processing. And then once they're here, they are completing those in-depth background checks and processings that would happen normally in refugee camps by when registered in that host country. They're happening in the United States. So all Afghans coming to the country are still undergoing those background checks and security screenings that refugees do on a regular basis. Sarah, do you want to talk about what normally happens when somebody comes to Iowa?
Yes, certainly. So once all kind of simultaneously, while all this processing is happening overseas, refugees their information is being sent to the 9 national resettlement agencies here in the United States. And every week, those 9 national resettlement agencies get together and allocate out the cases, the refugee families, to different cities and local sites across the country. At that point that is the point at which local resettlement sites like USCRI, Catholic Charities, and Catherine McCauley Center would first receive information about a refugee that may be coming into our local communities. At that point, we review the case file and start to begin preparations for the refugee to arrive. It varies in how long it takes from that point of someone being allocated or assigned to a site until when they arrive. Sometimes it's been as short as 1 or 2 weeks, and it can be as long as upwards of 1.5 years or 2 years. So it very much varies depending on how that overseas screening and medical screening and security screening process takes. But once we begin preparations, we receive arrival notices. We receive the flight information for refugees that are arriving into our local communities, and we begin preparations. If they have a friend or family member in the area, we work on contacting that friend or family member to verify that they still live in the area, and begin looking for apartments, looking for homes for the refugees to live in. We meet every single refugee at the airport and welcome them with open arms, and we begin our 90-day service period at that point. 90 days works very quickly. It goes very quickly, and there's a lot of information that needs to be covered during that time. The services that we are providing during those first 90 days are outlined through contracts and memorandums of understanding that we have with our national organizations. So USCRI works under the U.S. Committee for Refugees and Immigrants as one of the field offices. Catholic Charities works with U.S. Conference of Catholic Bishops, and Catherine McCauley Center in Cedar Rapids works under U.S. Committee for Refugees and Immigrants as well. And through those grants and contracts, it outlines when services are required to be provided, what the services have to look like, including in providing adequate translation from a third party, from someone that's not related to the family member, so that people understand what's happening through every step of the process. But those services include setting up a home, really making it a welcoming space for refugees as they enter into the community, helping children get enrolled in local schools, helping adults enroll in English language education, enrolling all eligible adults in employment services to help them find and secure jobs, as well as connecting people with medical appointments, applying for any public benefits that they are eligible for, applying for Social Security cards and documentation, and just supporting them in accomplishing their goals. Learning about the family and creating a service plan from which we determine what services are eligible and appropriate for that family. Like I said, 90 days goes very quickly. It's a quick amount of time to be given support as someone is entering into a new community. But we, all of the resettlement agencies in the state have a wonderful, wonderful staff, that many of which come from refugee communities, who are able to help act as a bridge between the communities that refugees are coming from and entering into the new community. So that is the process for what it looks like traditionally in the refugee resettlement program. And I will hand it back over to Mock to talk a little bit about the SIV program and kind of what some of the nuances are as we start talking about what things will look like for Afghans.
Great, thanks, Sarah. And a very nice overview by the resettlement agencies of how resettlement works. As noted, it's a very rigorous process. It's not easy. It takes a long time, and sometimes it seems like forever before families arrive. So whoever we can get as quickly as possible, that means they're safer and our community is better enriched. So when we are talking about the sort of the new group of individuals that will be arriving to the state, we really want to distinguish between SIVs and APAs, or humanitarian parolees. That's going to be the designation of the folks that are going to be arriving under the APA program. And Kellen or Carrie, if you could put that in the chat, what that means, that would be great. And we've been resettling as a state and as a country SIV since 2014. So SIVs are individuals who have worked with the United States military in Afghanistan and Iraq, primarily as interpreters and translators. These are individuals who have received certain privileges due to their affiliation and work with our government to be resettled to the United States as they see whenever they want it. If there was a circumstance that affected their well-being and their safety of that individual or the family of that individual, if they worked with the United States military and were processed as an SIV, would be able to gain certain privileges to be resettled to the United States. The majority of folks that we're going to be resettling as a state from Afghanistan here the next several weeks and moving forward are going to be humanitarian parolees. These are individuals who have not received SIV designation, who may or may not have been in the SIV process, or who may have not worked with the United States military, and who arrived directly from Afghanistan, essentially picked their things up, got on an airplane, arrived to a military base here in the United States, and were processed for a certain legal status. Humanitarian parolees will be eligible for certain benefits once they do arrive to their final destination, but those benefits will be very limited in the scope of resettlement services, where refugees, SIVs, those who have official ORR and PRM designations that have gone through the actual rigorous process as outlined, APAs are going to, humanitarian parolees, excuse me, are going to look a little different. And these individuals and their processing has been done here domestically. So the process that we heard that's done overseas, assurances, biometrics, health screening, security clearances, and then assurance to travel, all of that is condensed here on the military bases. And Carrie was on the field doing a lot of that work, and Carrie, if I misspeak or if I miss something, please let me know because you were there firsthand and you know how that process goes. The challenge that the community will face, and really a hurdle that we will face in working with APA humanitarian parolees, is really on the benefit side post the 90-day services that have been explicitly designated for these individuals. After the 90 days, it is yet to be determined what kind of benefits and services people may receive. We know that there are a lot of advocacy efforts at the federal level going on right now to pass certain resolutions that would provide funding for an entire package, sort of benefit package for these folks. As it currently stands, APA humanitarian parolees will be eligible for resettlement-like services, quasi-resettlement services, limited to basic necessities as far as housing, getting connected to employment, and I believe an initial refugee health screening, and then potentially finishing any sort of immunizations or vaccinations that they may have started in the military bases. How it currently looks as far as a timeline of when folks will be arriving, it's really dependent upon the level of processing and how quickly people are processed. If health screenings and biometrics are completed, and if there aren't any sort of other barriers, extenuating circumstances that would prevent people from being resettled to their final destination. People will be resettled all across the state. Each of the respective agencies on the call today, and with the addition of one agency in Sioux City and another in Council Bluffs, all have submitted capacity reports to their national headquarters in determining how many people they could serve, in addition to the number that already was set in the pipeline for refugee arrivals. So as a state, you know, that we will be resettling a lot more than initially anticipated. The number does fluctuate very quickly, I would say, and very persistently. It's a fluid situation and it could change on a dime here in the next 24 hours. But as it currently stands, we will be seeing folks arriving late September, early October, and then subsequently after, we will have a steady flow of arrivals. But again, that could change depending on the circumstances and mostly the health situations going on at the military bases, because it is encouraged and it's been determined that people need to be healthy to travel, and they need to be healthy for the journey. And so once we are arriving and receiving folks to our communities, we want to make sure that everything is set up for success. Carrie, I'll kind of turn it over to you a little bit if you want to share anything about your experience on the military base and what we would be expecting as a receiving community.
Yeah, so I had the opportunity to spend some time both at Fort Lee, which was the first processing center that was set up in the United States, where most of the special immigrant visa holders that were being evacuated went. And then I spent some time at Fort McCoy, where individuals that will be humanitarian parolees, part of the APA program, were being in-processed. We as an office have gotten arrivals from the evacuations already. The first one we received in mid-August had been evacuated and had the SIV paperwork completed. So they came in through the normal resettlement system and are fully benefits eligible as a regular ORR eligible population. On the end for folks that had not been through the SIV system, which includes medical checks and required vaccinations, one of the things that is happening on the military bases right now is that they are getting medical screenings that include a lot of the vaccinations we all get as kids in the United States, MMR, polio, chickenpox, those kinds of vaccinations, as well as COVID vaccines. So before anybody is able to travel off of the bases, they will have had basic vaccinations and basic medical screenings to make sure that they are able to be integrated in the community. We actually received a walk-in this week, is how we refer to folks. They had arranged their own travel after they had been through the medical screening and background screening process on one of the military bases. And that process is being led in cooperation between the Department of Defense, the Department of State, the voluntary agencies which do the resettlement, along with USCIS and the International Organization for Migration. So all of those things that we talked about are being stood up on those, I believe, 7 locations here in the United States. One of the biggest things to know about folks that have been evacuated is they're really a cross-section of Afghanistan. Most of them are at risk either through their family members' affiliations with the US government and US military, or are at risk due to violating some of the cultural norms that the Taliban and the new government are likely to enforce. So, you know, educated individuals, people who are not as religiously observant, people who believe in democracy. Those are the sorts of individuals that are there, and they're from all over the country. They're from both the major cities like Kabul, as well as the provinces. And they're just regular everyday people. There's a lot of screening that's going on before they come to the United States, and the Department of State has successfully screened out a number of individuals that had made it to those lily pads in their host countries. So those individuals have either been returned to Afghanistan or are being detained in those other countries. So the folks that are coming here are not a risk to the general population. They don't back terrorists, and they don't believe in harming individuals here in the United States. They just want a safe place to raise their kids and have their families and be part of a community. Sorry. Mark, do you have any?
No, I don't think so. I think, you know, with the conversation that we had a little bit ago, it will be imperative for the community to really come together and supporting not only the refugees that are in the pipeline and set to arrive, but also our most vulnerable, in particular, our APA recipients. So until we get more guidance from our federal partners in what a benefits package will look like, it will be incumbent upon everyone on this call and the greater community to really find ways post those 90-day services to help support these individuals. We are talking about very vulnerable populations with mental and physical health concerns. So a comprehensive sort of holistic approach will be necessary and imperative to support these individuals. And we can do it. I know that we can. We have the right people around the table here and on the call, and even our greater community. Many have stepped up. Many have offered their homes, their cars, food, whatever they have to help the incoming refugees. So we are excited. I think it's an exciting time with refugee resettlement, a time that we haven't been accustomed to these last 4 years, but it's nothing new to our state and to our country. We've answered the call before, and I'm confident we'll be able to answer the call again.
All right. Hey, and so for the resettlement directors, could we maybe hear a little bit more about what you have, what plans you have in place, and what that kind of resettlement might look like for each individual agency and community? Because, you know, we do have resettlement directors on this webinar today who represent more than just one community in the state. So Kellen, could I start with you and just hear about what you know, what this process or what the Afghan arrivals in specific then is going to look like for Catholic Charities here in Des Moines, and what you have in place?
Yeah, absolutely. So like Mock had mentioned, it's kind of a continually fluid changing situation, and kind of the information is changing daily, and we're kind of waiting for the official word. So we work with the United States Conference for Catholic Bishops. There are larger national resettlement agencies, so we're in communication with them weekly, and have let them know we are willing and able to welcome Afghan arrivals in addition to our kind of more traditional fiscal year 22 pipeline of arrivals. So we're kind of anticipating that. Right now, we're kind of just doing as many preparations as we can. We've had some wonderful community members reach out to help volunteer, donate time, donate funds, donate in-kind goods that we can help with setting up apartments, and that's kind of the main thing. We've made some partnerships on with existing landlords or property owners, and kind of some other kind of, I don't want to say non-traditional because it is something that is always an option, but kind of other options for housing APA arrivals kind of on a temporary basis. So we're kind of just working on all of those preparations right now. We're also kind of trying to build our team temporarily to kind of help assist with arrivals coming that we kind of anticipate here at the beginning of October. So right now it's a lot of preparation and being as prepared because we just don't know when arrivals will happen. We kind of keep hearing, like Mark said, end of September, early October. So that's what we're planning for, but it's just kind of an unknown right now. So a lot of preparation is what I feel like I'm doing. A lot of getting everything ready to go. So when we do start having arrivals, we are ready to welcome them, and the process kind of flows effortlessly. I'm going to say effortlessly because it will, but we have a great team here, and we hope to add to that team. And we're, like Mark said, we're confident and we're excited to kind of start this new phase. It's something new for us. So.
Thanks, Kellen. Carrie, could you share with us how or what plans that you have in place with US Sierra here in Des Moines?
Yeah, so we have resettled Afghan folks since 2014 through the SIV program, as well as some that had gone through the traditional refugee resettlement program. So we are working with some of our community connections to get ready to figure out what it is that we need. We've been collecting donations. We've been overwhelmed by community support, I'm sure, as Kellen and Sarah both have been. We are generally the largest resettlement organization in Iowa. And so right now, on top of our regular arrival schedule, we are looking at about 125 Afghan arrivals, but that may change. Like Mark said earlier, the numbers are very fluid. It will end up, how many people end up on the bases and being processed out, into communities. Iowa does have some Afghan communities here, so that will be helpful. And then we are looking for both volunteer and staff interpreters for Dari and Pashto. Those are the two national languages of Afghanistan. So we have been working with community members to identify individuals that can work as interpreters and translators for our office. And I think all three of us would agree, if you know folks that speak those languages, feel free to share our contact information. Like Kellen said, we don't know how quickly the arrivals will happen. We may get them all in short succession, or we may get them spread out for a few months. So I do want to ask patience from the community. I know you all have big hearts. You want to help as much as possible. But I must say that our office during the month of September has had our most active month in years. And that's regular refugee arrivals. So please bear with us. I know we don't have a lot of good answers on timing and exact needs at the end of the day, but we are happy to update as possible.
Thank you, Carrie. And hey, to Heather, True, and Megan, the questions in the Q&A, I'll get back to those after we hear from Sarah to hear about what resettlement plans are in place then for the Catherine McCauley Center in Cedar Rapids, and then we'll come back to the Q&A. And so for people that are thinking of questions, if you type those into the Q&A box, then we can, we'll come back and address those after hearing from Sarah. Sarah?
Yes. Echoing much of what Carrie and Kellen have said already. Catherine McCauley Center is the refugee resettlement service provider serving Eastern Iowa. So we are located in Cedar Rapids, but we are able to resettle individuals who have a friend or family member in the area within a 100-mile radius of our office, and individuals who do not have a friend or family member or contact in the area within 50-mile radius of our office. So that's kind of the landscape within which we work. Typically, we would anticipate that many of the Afghans will stay closer to our office because of proximity and ability to work more closely and more intensively with case managers. Much like Kellen and Carrie already mentioned, we are working diligently to meet the needs of the more traditional refugees that have been arriving in increasing numbers that we've seen there, but also working to make sure we have the right connections in place and systems and processes ready to accept and support Afghans that may not be eligible for as many services or as many benefits based on that parole status. So similarly, if we are always looking for people who speak Dari and Pashto so that we can make those connections and be able to provide those interpreted services to individuals. We are unsure how many people we will receive. We've submitted our capacity statement, but are waiting to see what the coming months will be. Like Carrie said, we're not sure if there will be a rush or if it will be drawn out over several months. We continue to explore options. We know that housing is a barrier across the state, but especially in Eastern Iowa after the derecho show. And so we are working with numerous partners to identify solutions to address that. But yeah, otherwise, Carrie and Kellen covered a lot of it. We are very much in communication regularly, and will continue to do so as the coming months and years go on. So.
All right, thank you, Sarah. And then there had been a question about individuals on the U.S. military bases that are having their medical exams and initial vaccinations there. Will they need then an additional refugee initial health exam once they've arrived or have been paired with a resettlement agency? Will it be repeating the same exam?
That's a good question. For individuals on the bases, they're getting their full, what would normally happen is an overseas medical screening. And so it will be identified if they have any health concerns that need to be taken care of once they get to their resettlement community. I have not been able to see one of those screenings yet. I'm hoping to see what the difference might be because it is being conducted inside the US. I do know that there will be individuals that come that will need booster vaccinations. So they may have had an MMR shot, but because they didn't go through the whole series as a kid, they'll need additional vaccinations. So there will be need for additional medical screening. But we are not being told by ORR or our national offices that they need the same in-depth medical screenings that refugees arriving from overseas are. I hope that's helpful.
Thanks, Carrie. So another question that had come in, how can civilians like college students or others get involved? Where can you go? Where can people go to volunteer and donate? And yeah, I'll leave that open to all of our refugee or resettlement agency directors to answer.
Well, I know for Catholic Charities, we have a whole bunch of information on our website about how to kind of what our specific needs are and different things and who to contact for which thing. I'm sure Carrie and Sarah have the same kind of thing. I know our contact information for the three of us has been shared publicly, and I'm sure Stephanie can share it again, but you're more than welcome to contact us directly, and we can either help you ourselves or connect you with the correct person on our team, kind of leading those efforts. So I think that would be probably the best way, and we could all use help across the board. So feel free to reach out to all of us if you want.
Yeah, similarly, on our website, because we're part of the national organization, it's just refugees.org. When you go to the home screen right now, there's information on Afghanistan, as well as a portal that you can donate to directly to our Afghanistan efforts, or you can use, there's contact information there too for the different programs.
Yeah, and Catherine McCauley Center, similar to USCRI and Catholic Charities, if you visit our website, cmc-cr.org, if you are in the Eastern Iowa area, there's right across the top bar, there's links for volunteering as well as giving if you're interested in giving in-kind goods or financially. And, you know, I think I always just like to note that while the Afghanistan situation has been top of news lately, the work that we do is, you know, covers crises and supports individuals and refugees coming from all over the world that have experienced hardship and trauma and been forced to flee their homes. So even if you give goods to many of us, it may go to an Afghan family, but it may go to a refugee family from Burma or from Congo that are also working to rebuild their life. So any support in any of the work that we do is always greatly appreciated. And I will highlight too, if you, assuming that everyone is in the Iowa area and near at least one of our offices, but if you have contacts, friends, family members in other states and other areas, there's a new website that's been launched called welcome.us, and I just put it into the chat. That has a kind of a reservoir of ways to get involved and contacts and who to reach out to in cities and states across the country. So feel free to share that with your friends and family so that they can get involved as well.
And real quick, Carrie and Sarah and I can put our contacts and websites in the chat as well. It's probably going to be the easiest for everybody. So we'll do that as well. So check the chat.
And we'll, yeah, when we send out follow-up after today's event, we can definitely include the direct contact information for your resettlement agency directors, and then Mock is our state bureau chief as well. And then we can also include the URL for each of the individual websites that'll actually take you straight to their links. And I did want to mention that you know, as things change and evolve, and as needs also change and evolve, that within the Rossi newsletter, if you don't get that already, anytime that we hear of any specific needs from any of the agencies, we also push that out in a weekly newsletter that goes out every Thursday morning. And then those links and contact information have also been available there. So if you do get those newsletters, and any announcements too, just in terms of like updates and changes of what's going on with the state. So if you do get those newsletters, you can look for that information there. And then we, Mock, we had a question about how many refugees Iowa has received so far after the withdrawal. Do you want to take that one?
Well, I think we've only received one family, Carrie. It was through USCRI. It was a US Thai case that was resettled to Norwalk, I believe, family of 5, and they are currently residing in Ankeny.
Okay, thank you. And then Sarah, I think this is the next Q&A question is for you. Given the housing shortage in Lynn County, is CMC exploring short-term housing or transitional housing before permanent housing may be arranged or available?
Absolutely. You know, while it's not ideal that someone would come to the US and enter into a temporary housing or a transitional housing situation, we would prefer that people can set down roots into a permanent home. But given the housing shortage and just given the time of it all, there is a possibility that people will go into transitional or temporary housing options And so, yes, we are working with local landlords, people with different housing options to identify what the best option is and what would work at any given time. So.
And then Mark, did you have any maybe additional input then on that question just across the state?
Yeah, so we've been working very closely with Governor Reynolds' office and IFA to look at what sorts of temporary housing options will potentially be available, given that there is a shortage, and this is across the state. We've had a handful of hotels and motels offer their supports in providing temporary housing at low or no cost that would be covered through emergency funds that are available. So housing, it's been a hot topic for some time, not only across Iowa, but across the entire country. From a personal perspective, in the conversations that we've had, for at least temporary transitional housing that would be able to support a family for, weeks or maybe even a few months, I'm not worried about it. As a network, we've really come together, and that availability will be there. It's the sort of long-term housing that will be a challenge, and we're looking at a multitude of avenues to partner with Anawim Housing, to partner with a company out of Louisville, Kentucky that provides housing, long-term housing specifically for refugees. And we're also looking through the state network on how we can mobilize through those mechanisms and providing housing, sustainable housing for folks as they do arrive to the state. And I think that another good example of housing and desire for the community to step up and support are individuals who have literally offered their land to build out housing. I had a conversation 2 days ago with the constituent and a representative out of East Polk County. He has 2 acres of land, wants to provide that land and to develop and build a house potentially for incoming refugees. So whether or not that's feasible in the next several months, I don't know, but the desire is there to help. And so whatever kind of help we can organize and streamline, we will definitely look at all options. But all options are on the table, and we've had many who've come to the table, and I'm confident that housing will not be a barrier for the short period.
Thank you, Mark. Thank you, Sarah. Another question had come in. So when arriving, what is their legal status? Do they get to apply for citizenship? And then how does that process work for SIVs and APAs?
For SIVs, they actually are legal permanent residents when that paperwork is processed. So they have what's commonly referred to as a green card. They still have the 5-year wait period for citizenship, but it's a benefit that comes from having worked with the US military or the federal government closely while we were in Afghanistan. For humanitarian parolees, those are some of the questions that are still on the table to be sorted out. And it depends on if there is any change in status at the federal level that either opens up more of the traditional refugee resettlement program or more of the traditional immigration programs to them. As of right now, they will not have a time limit in which they have to vacate the country. But what happens after they've been here a year or 5 years is kind of still fluid.
Thanks, Gary. And then another question that we had in the Q&A is, so for refugees that have already arrived in the United States, where are they now? And then are they settled in communities or waiting to be placed?
Can we get a little bit more clarity on that question? Is this pertaining to Afghan arrivals? Is this pertaining to refugees that have arrived? And what do we exactly mean by the question, where are they now?
Could you answer for both, Mock, maybe? Like where are Afghan arrivals right now?
Well, just the one family that has arrived to the state, as mentioned before, they're living in Ankeny. So the Des Moines metropolitan area. Refugees that arrive to Iowa with the respective communities that are represented on here will either be residing in Des Moines and the greater Des Moines area, or they will be in Cedar Rapids in the greater Cedar Rapids area. Excuse me, we have some families that have arrived to the western part of the state. Excuse me, I got a cough. To the western part of the state, as we see new resettlement agencies pop up in western Iowa, there will be direct resettlement into the western part as well. If we're talking about secondary migrants, folks who are resettled to a different part of the country, then decide to come to Iowa, they are living wherever there's availability for housing and employment. So that's across the state. If we're talking more specifically, you know, we don't really share that information out. It's more of a general area of Iowa. So I hope that that question is answered, the first part. And then are they already settled in communities or waiting to be placed? You know, for individuals who have been set for travel and are being directly resettled by the resettlement agencies are placed in homes and they are living in communities. Anyone who is, I guess, waiting to be placed with respect to APAs and those who will be arriving from overseas are still in process. So they may be living in their second country of asylum, waiting for travel, or they may be waiting to finish their processing at one of the military bases before they arrive to the state of Iowa.
And I was going to share for some larger context on where Afghan arrivals are overall. The U.S. has evacuated about 60,000 Afghan nationals. Of those, about 32,000 have gone to military bases for processing. 18,000 are still overseas on those third country lily pads. And so if you do that math, that leaves about 10,000 people. And that number reflects people that had their SIV paperwork well into process when they were evacuated. And so when they came to the United States, they went to their final destinations. Those areas are communities around Sacramento and San Diego in California, Northern Virginia, of course, close to Washington, D.C., where they have members of the military that they work with as U.S. ties, and to some communities in Texas. And so there are about then 10,000 Afghans that have been resettled nationally, but the bulk are still waiting to go to their final destinations.
All right, thank you, Carrie. All right, well, we have about 5 minutes left in the hour that we had reserved for this event. Does anybody have any more questions that they would like to get answered in this Q&A? You can type in, and then while people are typing, I just wanted to remind everybody that a recording of this webinar will be available on the RASI website after the event today. And so that will be in the same place that you went to go register, that same web page. There will be a link there. Instead of register here, it'll say access the recording here. And then we can absolutely make sure that that contact information is shared to those who are registered for the event today. And then, yeah, just be sure to look for updates in terms of needs or updates in terms of what's going on across the state. In the newsletters, we will be sure to share that out as things evolve, because yeah, I mean, this, you know, the situation I think across the entire country is kind of ever evolving. And so as we get more information that's relative to our communities here in Iowa, we will definitely you know, share that out across the network. Any other questions for our resettlement directors and state bureau chief? Okay, all right. Well, thank you everyone for joining us today. We really appreciate your time and your presence and support. And yeah, if you have any questions for any of our panelists today, please feel free to reach out to them directly afterwards. Thank you, everybody.